What's up, everybody? Today I'm answering one of the most common questions that we get on our channel around slap tears, and it is, what do I do if when I'm doing slap tear rehab, if it causes me too much pain and I can't do the exercises? So this episode was inspired by a question on one of my videos. So I'm going to read the question for those of you that will be listening to the podcast, and I'll pull it up on screen here. So Avian, that's an alias, the name. Okay, here's the question. I discovered your channel recently. You seem to be a good person from what I could infer so far. I have issues with both my shoulders. Sorry, bear with me. This will be a long post. Right shoulder, had a labrum repair surgery almost 4 years back. Just after surgery, I had to take care of multiple health issues, surgeries and COVID in my family, and just couldn't focus on rehab properly for around 6 months. And after that, however much I try, I couldn't rehab due to pain for more than a week. I visited different surgeons with multiple MRIs. They say there is nothing wrong with the joint or anchors. Right now, I can't do basic things like a bath or lift a kilogram of weight or stretch without pain in my shoulder, scapula, neck, and arm later. My recent visit to the surgeon with an MRI was 2 weeks back, when I was told that the joints, surrounding muscles, and supporting structure has atrophied and abnormal scapular movement was observed. Scapular taping, scapular stabilization exercises, pectoralis minor stretches, TheraBand cuff strengthening, and nerve block injection to reduce the pain while doing rehab were recommended. Left shoulder. I injured my left shoulder 3 weeks back while pulling a heavy object. My surgeon says after looking at an MRI that the small superior anterior labrum tear, partial thickness tear of supraspinatus tendon, and a small cyst were observed. I have a few questions. For the left shoulder, how long after the injury can we start doing physiotherapy? Is there, or for those of you in the United States, that's physical therapy. Is there a resting period so that the injury can heal? Question 2, can we do PT with pain? And question 3, can these exercises or rehab plan also help my shoulder, for which I had surgery 4 years back and have issues as mentioned in my post? Excuse me. So this line of questioning is so common for me. I've had a slap tear in both shoulders and rehab them without surgery, and I'm stronger now than I was before I did my slap tears, and I can do things now that I couldn't do before my slap tears, and it's because of the process that I'm going to share with you guys here. Basically, I was fortunate enough to have a couple of friends who are top physical therapists in Australia who work for professional footballing teams. And physical therapists that work for professional athletes have a very, very different goal than your general population physical therapist. Which a general population physical therapist, they look at people from a really broad range, and most of the people that they look at aren't very serious about their training at all. In fact, if you look at the average person doesn't really take exercise seriously at all. The people that are watching this channel and myself, I'm very serious about what I do. So somebody that deals with those people wasn't giving me the advice that was conducive of the life that I live and the life that I want to live. And they give you a really basic rehab plan that's kind of intended for somebody that would barely even go to the gym 2 or 3 times a week for 20 minutes if they were forced to, you know. Whereas a physical therapist that works for professional athlete. Oh, and so one more thing, and this is this is the sad truth, but a physical therapist that works with general population, within their business model, they need to get repeat visits. That's otherwise they just don't have business. You know, if you're a personal trainer, if you're a doctor, if you're a dentist, you need people coming in and paying the bills. Otherwise, you don't have a business. So they have a rehab plan that is kind of drawn out and designed to keep people coming back, rather than keep them progressing and get them as good as they can, as quick as they can. And I'm getting that from insider knowledge. I'm getting that from hearing it from my physical therapy friends who went and worked in physical therapy clinics, and they were told that this is what you should do with patients. Now, a physical therapist that works with a professional athlete is very, very different. They're on a salary, they're on a wage, and in fact, their job is going to be at stake if they can't get those athletes back on the field as quick as possible and playing. So the way that they approach physical therapy is vastly different. And the guys that I'm friends with, that my brother Yanni and I are friends with, they don't see general population. They only saw me and my brother Yanni when he had his slap tears, because we're friends with them and we've been friends for many, many years. And the rehab plan that they gave us and the strategy that we did, we were getting better every week. Like every week you get better. And I've since taken that strategy, turned it into the online coaching that I give to people around the world. And we have people from all around the world that are having similar results. So people that have gone to surgeons, to doctors, to physical therapists, and their slap tear just hasn't improved. And within 28 days of working with me online, they have a better result than all of the professionals that they saw before. And that's all validated by Google reviews. If you go and look at our Google reviews, click on the newest tab, every 5th review, you'll see somebody raving about how their slap tear is better than it ever was before. So what I'm about to describe to you has come from that process. Now, if I go and look at your 3 questions here. So for the left shoulder, how long after the injury should we start doing physical therapy? Is there a resting period so that the injury can heal? Absolutely not. You should start doing physical therapy the day after your injury. The only thing you may need to do is wait for a little bit of chronic inflammation to subside, but that's going to happen within a couple of days. So if it was an acute injury and you have chronic inflammation that's really restricting your range of motion, you might want to wait until that subsides. But in all honesty, if I had my slap tear again and the chronic inflammation was that bad, I would probably take anti-inflammatory tablets so that I could start rehab straight away. And I'll tell you why, because it ties into a lot of what you've said in your comments here, where you've talked about the atrophy of muscle mass, and that's what's shown up in the MRI, and that's what surgeons are looking at, that's what doctors are seeing. That is very real. You know, the atrophy of muscle mass that happens when you stop moving is happening immediately. And the longer you leave it for, the worse it gets. And if you're over the age of 35, it is very bad when you lose muscle mass. If you're over the age of 45, it's disastrous. And if you're over the age of 55 and you're losing muscle mass, it can be catastrophic. It is so hard to rebuild muscle mass the older you get. Like our bodies are naturally, our muscle mass is naturally on the decline after the age of 35. Statistically, men lose 0.6% of their muscle mass every year after the age of 35. Women, it's worse. Women lose up to between 0.9 and 1.2% per year, which is all reversible with resistance training, reversible and preventable with resistance training. So if you do good strength training, you're going to fix it. Now, when you've had a slap tear, the basic strategy to fix it is that you need to make everything around the structure as strong as possible. So we need to strengthen the scapular stabilizers. We need to strengthen the rotator cuff so that it's holding the humerus in the glenohumeral joint and preventing joint glide. Because when the rotator cuff weakens and loses function, the humerus, so this bone in the upper arm here, it's sitting in the glenohumeral joint where it's meant to move like that, it starts to move like this and get joint glide, and that's agony. That's when you try and lift your arm up, and when you get to here and it's meant to keep going like that, and it starts going like that, and you go, oh, like that, and you feel that pain. And then we need to strengthen the prime movers, so the phasic muscles, the big muscles on the outside, so the pecs, the deltoids, biceps, triceps, the lats. And by becoming strong enough, your body basically just overrides any issues that are within the slap tear. And like an MRI will still show that I have a slap tear in both shoulders, but I'm asymptomatic. I have no symptoms, and I can do whatever I want. You know, I can lift my arms overhead, I can do handstands, I can do muscle ups, I can do all the exercises that I want to be able to do. And if you go back to when I just had my slap tear, like I couldn't even lift my arm past here. I was in agony, and it was one of the worst experiences of my life, you know, getting told, for somebody that's as serious about working out as I am, you know, I was told by surgeons that I had to get surgery. They said, you have to get surgery and you'll never be able to do the things that you want to do again. So I'm really fortunate that I had the guidance that I had, and I'm really hoping that what I'm passing on to you guys here that have a slap tear, that you really listen to this and that you act on it, because I'm telling you right now that this stuff works. And if you want to know more about it, get the Slap Tear Rehab Blueprint. It's free. If you just go into the description of this video, you can get it. And I'll answer your guys' question in just a minute. I'm going to, I've just going to answer the question that this video is about, and then I'll answer the questions in the live feed. Okay, so if you guys just give me a minute, I'll get to you. So, how long after the injury should you start doing physical therapy? Immediately, because you don't want to be getting weaker. And motion is lotion. The like movement, motion is what is going to make the slap tear better. The only sporting injury that you should rest for really is a fractured bone. This is coming from my physical therapy friends. There is pretty much no other sporting injury where rest is the best solution. Because a fractured bone, when a bone's been fractured, it has to set back in place and movement is bad. That's why they used to put fractures in a cast to keep it still and immobilized. But, muscle tears, slap tears, tendonitis, tendinopathy, things like that, motion is the thing that is going to fix it. So you need to become stronger and you need to stimulate blood flow. So that's the first part to your question. Number 2, can you do physical therapy with pain, or can you do PT with pain? Absolutely. And I'm going to talk you through this. This is where having a coach, an expert who's been down that path before you, is going to be vital for your recovery. So somebody like me who's walked the path before you and who can make sure you're doing things the right way. Because when you have pain, one of the biggest myths about having shoulder pain or having a slap tear is this exercise hurts, so I'm not going to do it and I'm going to wait until the pain stops and then I'll start doing the exercise. That is a surefire way to make sure that your shoulder never gets better. I guarantee you. Because what you're doing is you're going down that route of where your body is going to start atrophying. So the muscles are going to start atrophying, deteriorating, and you're not addressing what needs to be addressed for the slap tear pain to subside, which is that you need to make your shoulder stronger. So there's multiple variables that you work with when you have pain. So one of the first ones is range of motion. So a lot of people, for example, they'll say, I can't do shoulder pressing because it hurts my shoulder. So I'm not going to do any kind of pressing because it hurts my shoulder. I'll wait until the pain's gone. Well, that's a completely flawed approach, because we need to train the muscles that are controlling pressing. So if we go down to a chest press, that is still training the same muscle groups, but you're doing it in a range of motion where you don't come into that point of pain. And if a chest press still hurts, you do a floor press where it's even a reduced range of motion. So, and you can do that with any exercise. Any exercise, we can reduce the range of motion. And you find the pain-free range that you can train. And that might mean that it's a really small range of motion. Like with an external rotation, you might want to be able to go right out to here, but it hurts you if you go beyond there. Well, you train that range of motion. You train the pain-free range. And you always push right to the edge of where that pain-free range is. And over a pretty short time, the pain-free range will improve and you'll be able to do more. Next is we have intensity, is to reduce the intensity. So you reduce the amount of weight you lift. And what you've got to understand when you have a slap tear is that shoulder is that joint right there is the weak link in the kinetic chain. So you've got this kinetic chain going shoulder, elbow, wrist, fingers, and they're all the joints that are controlling the movement. So whatever the weak part is in that kinetic chain, you'll only be able to train the amount of weight that weak link can handle. And that might mean that you feel like you're, pressing or rowing or curling or whatever, a weight that's just so light you think this is useless. It's not. It's not going to train your maximal strength, but it's going to train the shoulder with what it needs to get better. And of course, as you improve, your tolerance will increase, or your load capacity will increase, and you'll be able to start lifting more weights again. And then next we have volume. So volume we can manipulate either by reducing the amount of reps in a set or reducing the amount of sets in a workout. So you might get told that you need to do 8 to 12 reps in a set. But as soon as you get to 5 reps, if you try and do 6 or 7, it starts to hurt. Well, then you do 5 reps. You do what you can pain-free, and then you use progressive overload to be able to get up to that 8 or 12 reps. So, each workout you try and increase 1 rep per set. And then you can also manipulate tempo. So, the time of the eccentric contraction when the muscle's lengthening, the time of the concentric contraction. And then you've also got exercise complexity that you can manipulate as well. So how complex or how simple the exercise is. Now, if that all confuses you, that's why you work with somebody. Because this stuff, as a coach, you spend a lot of time learning how to do this stuff. And this is why people go to physical therapists, and it's why people go to, personal trainers, because it's not easy to understand how to do this stuff. And for the average person hears these things, they go and try it, they feel pain, and they think, I've got to rest until the pain goes away. And that's not how it works. I've explained that. do not rest until the pain goes away. You're going to be losing your muscle mass. And so the last parts of this question is, can these exercises or rehab plan also help my right shoulder, for which I had surgery 4 years back and have issues as mentioned in your post? Absolutely it can. Not only can it is vital that you do that you approach this strength training with both shoulders to get them better. It's the only way you're going to get them better. You like even with surgery, you still need to do strength training to make your shoulder stronger. You have to. It's the only way that you're ever going to fully recover and fully repair. And even if you've had a bad experience with surgery, exercise and rehab is still the option. Is still the solution. Being as strong as you can is what you need to do. And you know, this is why my brother Yanni and I, who runs Unity Gym online with me, we've done many different business plans before. We used to do personal training when we were at Unity Gym, where we charged $150 an hour. When we started doing our online business, we were doing a similar model where we were charging people $150 a week, and we were doing, calls like this, like a face-to-face call where the person was on a call and we were talking to them. And it's the same idea with physical therapy. I think it's a broken business model, because very few people can afford to pay that amount of money ongoing, can afford to pay, $150 per session ongoing, which is what good physical therapy costs. The physical therapy in Australia is, between $120 and $150 per session. Nobody can afford that. Well, I shouldn't say nobody, but very few people can afford that long term. And even same with an online coaching business where you're charging $150 a week. Most people won't be able to afford that long term. Most people are going to look at that like, okay, well, I'll do this for 12 weeks and then I'll stop. But to get from where you are to stronger than you were before a slap tear, it's this process that you build on week by week by week by week. Like every week, what I do with my clients is I review their progress, I tweak their program, and we adjust their program either every 2 weeks or every 4 weeks, sometimes every 6 weeks. It depends on how they're progressing. And that whole process is something that continues on until they get to a point where they're like, my shoulder's 100% where it is. And for some people, everybody gets an incredible reduction in pain and increase in range of motion within a month. But it depends on how far people want to go with it. But for this reason, this is why we charge $49 a month for what we do, because it's the only way that people can afford to do something long term. So if you're sitting here watching this and you're questioning, how do I do this? What do I do? Don't question it any longer. Come and join my online personal training and I'll do all of this for you, and you don't have to question it. And you can get coaching from me as well. I provide coaching by doing video reviews. So you submit videos and I do a screen recording where I'm watching you. So you get one-on-one coaching. It's just not on a call. And that's a shameless plug, but I'm saying it because honestly, it is the best way to get better. So if you want to do it, go to unitygym.com/slaptear. All right, I'm going to answer your questions here. So Anton has said, can I get it for free, bro? You just for a month. You're only 16 and you don't even have $50. You want to return to handball and avoid surgery. Send me an email, Anton. Send me an email, rad@unitygym.com, and I'll see how I can help you. Sahel is saying, hey man, how you going? I'm not sure if Sahel is a man or a woman name. So I was going to say, hey bro, but I don't know if you're a man or a woman. So hello, Sahel. Mr. Tigris, what's the difference between bicep tendonitis and a slap tear? Good question. So from what I've been taught by my physical therapy friends, tendonitis is not an accurate term for what's actually going on in the tendon. What physical therapists use now, the terminology they use is tendinopathy. And it's because it's inflammation of the tendon. So tendinopathy of the biceps or biceps tendinopathy, you've got tendons. The tendon is where the muscle connects to the bone. So it's the smallest part of the muscle and it's where the most load goes, which is why people so often get tendinopathy, because when the muscle pulls, you've got, like, you look at the bicep, you've got this big muscle here and it all comes down to this tiny little tendon, okay? And so tendinopathy is inflammation to the tendon. So you can have tendinopathy on the distal part of the bicep, which is furthest away from your center of mass, or you can have tendinopathy on the proximal part of the bicep, which is the closer part to your center of mass. And the bicep, the long head of the bicep actually connects directly to the superior labrum, which is exactly where a slap tear occurs, which is why you often get bicep pain when you have a slap tear. And a slap tear is a superior labrum anterior to posterior. So you've got the labrum in here, which is what the humerus sits in, and the superior part of the labrum, the upper part, running from anterior to posterior. So it's a tear that runs from the front to the back of the labrum, and it's right where that long head of the bicep connects. So it's often associated with an abusive load to the long head of the bicep. When you're going into shoulder extension like this, when the long head of the bicep is straightening and it pulls on that labrum and it causes a slap tear. So they're often things that occur together. Muhammad is saying, can imbalances in lower body be the reason why slap tear isn't getting better? I have pain in my right hip, ankle, ribs sometimes, and I want to know if it could be related to your shoulder pain. I'm not going to say it can't, but I doubt it. I highly doubt that what's going on in your lower body is the reason why your slap tear isn't getting better. I would say that is more of an indication of what's going on in your entire body. So, if you have a history of injury where you're just getting injured, then there's something going on in your system, man. You need to look at chronic inflammation. You need to look at how much sleep you're getting. Are you prioritizing good sleep? Are you prioritizing good nutrition? Are you creating the environment within your body to heal? Because that is a huge part. Your body is a reflection of your choices. So you've got to look at what choices you're making that might be causing you to be in this state. And I've actually got a really good video. You should go to my channel. And it's within the 10 or 15 most recent videos. Why do I keep getting injured or something like that? You should watch that video. It's a really, really good video for you. Mr. Nobody's saying nothing in life is free. Well, some things are, but if you want to work with a coach or somebody that's going to, really help you and guide you, then of course, everybody needs to be reimbursed for their time. So of course, those kinds of things cost money. Guys, I have to go. I've got a class that I have to teach now. I've got a group of locals here at Avoca Beach that I teach. I hope that I taught you something. I did this live stream because I saw a question there that I thought I could really help and provide a solution to. Mr. Tigris is saying, if we don't treat bicep tendonitis, can it become a slap tear? Look, I'm not a physical therapist. I'm going to say this quickly. I'm not a physical therapist. I'm not a doctor. So you are delving into a realm that is beyond my scope of practice. I don't know that. I can't answer that, but I highly doubt it. Bicep tendonitis doesn't just become a slap tear. There has to be an abusive load on the labrum for that to happen. Clint Whitford saying, thanks for the information today. You appreciate it. You're absolutely welcome, Clint. Have a great day. And guys, if you want to learn more about this, go and get the Slap Tear Rehab Blueprint. It's free. There's a link in the description of this video or this podcast. I've got a run team. If you've got any questions or anything you want me to do in a live stream tomorrow, let me know, and I'll do a live stream on your question for you. See you later, everybody. Have a